When we talk about heart screening tests, there are various types of tests that can be done. The most basic that one should be going in terms of the screening test would be what a test called ECG or electrocardiogram. This is a test whereby we look for the electrical conduction or the electrical activity of the heart when they contract. And from this ECG, we can tell some or few abnormalities that can be detected earlier. The next after an ECG is a test whereby we do an echocardiogram, whereby we actually visualize a bit like an ultrasound of the heart, and we look at the heart function, we look at the size, and we look at the valve and various other things. After an echocardiogram, then we may consider what we call as a stress test or a stress echocardiogram, whereby we subject someone on a treadmill test where it will become faster and the inclination of the treadmill, and we can look at the heart function, especially when they are exerting themselves, and look for any abnormal ECGs when this happens. Next after that is a test we call CT coronary angiogram, or also should normally include CT calcium scoring, whereby it will look at the coronary artery itself to look for any blockage, to look for any calcium, and to look for any potential problems in the future. The last one that can be considered is what we call as a coronary angiogram, whereby we put a tube from the hand or from the leg up to the heart, and we look for any sort of blockage and to look at how much percentage of the blockage is. In terms of what sort of tests that I should be going with, first, of course, this is as per discussed with especially the cardiologist or the physician. And the higher the risk is, or the more complaint that we have in terms of the symptoms, we should be thinking of slightly more invasive tests like a CT coronary angiogram or angiogram itself. But if we have very low risks and we don't have any other risk factors, then we may want to consider just to do something like a stress test or an ECG or an echocardiogram.